tell us the story about how you got diagnosed with multiple sclerosis?
Yes. Well, originally, the first day I noticed that I was having an outbreak, I woke up. It was the day I had a brand new job, and I could not see out of my left eye. It was completely just pitch black. So I walked to my parents' room down the hall, and where I saw my mother, and I asked her, do you see anything on my face? Anything, just trying to hear anything she would say that was out of the ordinary. And she was like, oh no, it's, everything looks good. And I said, okay, I can't see out of my eye, but I have to go to work. I want to touch back on this a little bit later. So eventually I come home, my mom asks me again, how is it? And I said, it's getting worse. So the next day, she takes me to go see an eye doctor. And the doctor, looking at my eyes for about maybe 5 minutes, and stops, turns the machine off, everything, sits right next to me and my mom, tells us he doesn't see anything, nothing at all, and thinks it might be something a little more serious. So of course, I wasn't very happy to hear that, but I was just like, okay, thank you. Thank you very much. We'll be in touch. And he told me, I'm going to call you in a couple of days and make sure you're getting treatment for yourself. I said, okay, thank you. So I get home, and my mother and I are waiting for my dad to get home. Just waiting, just so anxious about what to do next. Finally, my dad comes home, we talk about it for about maybe a minute, and he says, you know what, we're going straight to the hospital, forget this. So we go to the hospital. I wait for about 2 hours before I'm actually seen, brought in. And they start right away asking me questions, what's going on, because I did not have a medical file before this. So I eventually spent one night in the ER, did not find anything wrong with me, took a bunch of blood samples, couldn't see anything at all. So eventually they let me leave, told me to come back if things get worse. So
you went back?
Yeah, of course I went back within the next few days. I started to get a drop foot. I was having extreme difficulties trying to just walk. Eventually, when I went back, they finally admitted me and started to take more blood and doing the same tests that they were doing before, until finally somebody says, there's a doctor there, says I can get an MRI done.
Right.
I finally get the MRI done, and we find out that there's lesions all over my brain and my spine. And I'm thinking, oh my goodness, what I did not even in my wildest dreams imagine that something like that would happen to myself. So, but the doctor says it's between 3 different possible things. The first thing was cancer. The second thing was vasculitis. And the third, of course, was MS. And of course, you hear cancer, everybody knows what cancer is. The other 2 things I wasn't really that sure about.
Right.
So right away, I'm thinking, God, please don't be cancer. So sure enough, days go by, still doing tests. My exasperations get even worse. I cannot walk. My left hand, the whole left side, is completely numb. And so I remember meeting this brain surgeon, and we were talking about doing a brain biopsy on myself. And I said, whatever you guys want to do, please do it. I want to get some answers. So sure enough, within, I think it was like maybe 2 or 3 days after that, I had a brain biopsy done. They had me on a machine with Solumetrol, and about a week later, I would meet my neurologist and the surgeon again. They talked about it being multiple sclerosis and what medicine regimen they had planned out for me and what we were going to do going forward.
All right. Well, thank you for telling us your story.
Thank you.
You share with us some advice that you might have for people as far as how to talk with their doctors about their multiple sclerosis to get the most out of their visits with their multiple sclerosis physician?
Of course. Well, the first thing I would say is ask questions. Do not be afraid to ask questions. You're only going to be hurting yourself. So I can remember when I first got diagnosed, how scared I was. And I would talk to my father. Thank God I have my father. we would just go back and forth, and he would just tell me, don't let this change who you are. Sure, things are different now. You're dealing with something a little different, but don't let that stop Jimmy Munding from being Jimmy Munding. And ever since, I heard that, that's just how I choose to live my life. So you guys, people just need to get educated and find out if this is affecting you or somebody that you love or get answers. Don't be afraid to reach out and find out the information you need.
Great. And as far as living day to day, in your day-to-day life living with multiple sclerosis, what advice do you have for people about that?
Again, don't stop doing what you're doing. What I like to do personally, I just try and stay healthy, or as healthy as I can. And I haven't, my whole life hasn't just completely flipped upside down. I still do the things that make me who I am, but I just have a whole nother perspective on the decisions that I make. Just because, I have to think about how is this going to affect me going forward. Is it worth it? Is it going to hurt me? Do I want to do that? So I just, I'm just totally brutally honest with myself. Really, do you want to do that? Is that worth it to you? So, because I can just picture my parents being like, is this where you want to be? When God, or anything like that. It just goes off in my head, and that's just how I am. That's just who I am. I refuse to let this beat me or anything beat me. So, but especially this disease that I'm now forced to deal with. So, my whole thing, the biggest thing I can tell people is just, be proactive. Do not stop trying to, do better. Do better for yourself. And just remember, just please remember, there are no ceilings. There's only the sky, and the sky is the limit.
Wonderful. I love your philosophy, and thank you so much for telling us your perspectives. I think that's going to help a lot of people.
Awesome. Thank you very much, Doctor.
You're welcome.